Australia is famous for dangerous wildlife, but the real story is less sensational. Most animals avoid people, serious incidents are uncommon, and correct first aid matters far more than fear. Venom is delivered through a bite, sting, spine, or spur. Poison causes harm when it is swallowed, absorbed, or sometimes touched. An animal can be venomous without being poisonous, and a plant can be poisonous without injecting anything. Eastern brown snakes occur across much of eastern and central Australia, including farmland and urban edges. Their bites can cause severe, life-threatening poisoning, and the bite marks may be difficult to see. Treat every suspected snake bite as an emergency. Call 000, keep the person still, apply a pressure immobilization bandage to the bitten limb, and splint it. Do not wash, cut, suck, or tourniquet the bite, and never try to catch the snake. The inland taipan is famous for exceptionally potent venom in laboratory testing. But real-world danger depends on more than venom potency. Exposure, dose, behavior, location, and access to treatment all matter. The snake lives in remote inland habitat and encounters are rare, but any suspected bite still requires immediate emergency treatment. Australian funnel web bites are medical emergencies. Call 000, keep the person still, and use pressure immobilization for a funnel web bite or a bite from an unidentified big black spider. Redback bites are handled differently. Wash the area and apply a cold pack for 15 minutes. Do not use pressure immobilization for a redback bite and seek medical care for severe pain or other symptoms. In northern tropical waters, major box jellyfish stings can cause collapse within minutes. Call 000. Start cardiopulmonary resuscitation if needed, and pour vinegar over the sting for at least 30 seconds before removing tentacles. This is not the treatment for bluebottle stings, which are rinsed with seawater and treated with hot water, not vinegar. Luring octopuses and cone snails can deliver powerful nerve-acting venom, and the wound may be small or almost painless. Call 000. Apply pressure immobilization to a bitten limb, keep the person still, and begin cardiopulmonary resuscitation if breathing stops. Never handle a small octopus or pick up a live cone shell. Stonefish are masters of camouflage, and their venomous dorsal spines can cause intense pain and serious illness. Call 000. Even embedded spine in place, unless the ambulance operator says otherwise. Put the affected area in hot water, no hotter than can be comfortably tolerated, for up to 30 minutes. Only male platypuses carry a venom-delivering spur on each hind ankle. The injury is not known to have killed a person, but it can cause severe and persistent pain and swelling. Do not handle a wild or distressed platypus and seek urgent medical care after a spur injury. Cane toads are poisonous rather than venomous. Their skin glands secrete toxin, and toxin is also present in body tissues, eggs, and tadpoles. Exposure can injure the eyes or, if swallowed, affect the heart, blood pressure, and breathing. Rinse exposed eyes with water for 15 minutes and call the Poisons Information Center on 13 11 26. For severe symptoms, call 000. Oleander is a common ornamental plant, but every part of it is toxic. Significant ingestion can cause vomiting, dizziness, dangerous changes in heart rhythm, seizures, coma, and death. If any part is swallowed, call the Poisons Information Center immediately and do not induce vomiting. The castor oil plant contains highly toxic seeds. Chewed seeds can cause delayed, severe vomiting, diarrhea, bleeding, liver damage, and life-threatening poisoning. Never eat the raw seeds and call the Poisons Information Center without waiting for symptoms. Cycads and native zinnias often produce striking red or orange seeds. Raw fruit or seeds can cause severe stomach symptoms, and rare cases have led to liver damage, coma, or death. Keep seed material away from children and pets, and call the Poisons Information Center after any suspected ingestion. The Gimpy stinging tree is covered in fine hairs that can cause intense and persistent pain. Do not rub or scratch the affected skin. Health Direct notes that there is no universally agreed first aid, but recommends using hair removal wax strips to lift out the hairs and seeking medical care. Remember, pressure immobilization is used for snake bites, funnel web or suspicious big black spider bites, and limb bites from a blue-ringed octopus or cone shell. It is not used for redback bites, stonefish stings, or jellyfish stings. For life-threatening symptoms, call 000. For suspected poisoning, call 131126. Identification can help, but never risk another bite, sting, or exposure to capture an animal. This video is educational and is not a substitute for emergency instructions. Follow the advice of the ambulance operator, lifeguard, doctor, or poisons information specialist. Most Australian wildlife is best appreciated with distance and respect.